is John and Jane Doe. John and Jane lived a good life. They were healthy, they had stable jobs, and they were happy. One night, they were driving home from work when they got in a car accident. Jane had minor injuries from the accident, but was experiencing a lot of head pain. John's injuries were more severe, and he was experiencing back pain. The doctor decided to prescribe them opioid medication. John and Jane went home to recover and continue their everyday lives. Jane was starting to feel better. Although her pain had subsided, Jane kept taking the medication, thinking about it often. On the other hand, John was still experiencing back pain. He continued to take his opioid medication, often taking more than was prescribed. One night, John went to sleep and never woke up. Jane was heartbroken and confused about what had happened. The doctor explained that John suffered from opioid-induced respiratory depression, diminishing his breathing, leading to cardiorespiratory collapse and ultimately death. Jane continued taking her opioid prescription, often taking more than needed. The medication started affecting her behavior and emotions. Jane realized that she had a problem and knew she needed help. Jane explained the situation to her doctor. The doctor assured Jane that she is not alone and began to educate Jane about opioids and addiction. What are opioids? These prescription opioids can help relieve pain short-term, but also come with serious risks. An estimated 27 million people suffered from opioid disorders in 2016 worldwide. About 45% of opioid users experience non-fatal overdose. In 2015, roughly 118,000 people died from opioid use disorders. More than 11.5 million Americans reported misusing prescription opioids in 2016. 115 Americans die every day from opioid overdose. In Canada, there were 2,946 opioid-related deaths in 2015. In Australia, 70% of drug-related deaths are due to opioid overdose. Public health officials around the globe are working to develop new treatments for opioid addiction, overdose prevention, and reversal. Jane started receiving treatment for her opioid addiction and learned proper disposal of unused medications. Throughout treatment, Jane realized that she was not alone, developing many friendships along the way. By the help of her doctor, treatment professionals, and friends, Jane is no longer addicted to opioids and is back to her healthy behaviors. Collaboration is essential for success in preventing opioid overdose deaths. Together, we can better coordinate efforts to prevent opioid overdoses and deaths. CDC.